Hello, everyone. Welcome. My name is Elisha Dunn-Georgiou, and I'm the President and CEO of Global Health Council. Thank you all for joining us today. I'm very excited to open this CSO Summit, Elevating Civil Society and Community Voices in Global Health. This summit follows a year of work led by our Director of Special Projects, Eliana Montefuerte, examining the impact of COVID-19 on marginalized populations, both in the US and abroad, and examining what we can collectively do to improve equity in public health programs and policies, whether at the local, national, or global levels. We started this in what I think we can now say were the early days of COVID, and unfortunately thought it would be done by now. But if COVID has shown us anything, starting at the very beginning, is that inequities abound in our health, social, and economic systems, and that's not okay. At Global Health Council, we believe that health for some is not good enough. An equitable opportunity to be as healthy as possible is necessary for all. And as you'll hear from today's speakers, achieving that equity requires a collective approach that reaches across sectors, communities, and countries with health and social justice at its core. We must break down the obstacles, such as poverty, discrimination, and stigma, that continue to adversely affect those who are marginalized and unable to access care. And importantly, as funding and policy decisions are made, key affected populations must play a leading role in developing the solutions that will work best in their unique community contexts. We'll explore those issues today with our keynote speaker and our panel of experts, and we look forward to a fruitful discussion, and we'll welcome your questions and comments throughout the day. I encourage everyone to use the chat to introduce yourself, pose questions, and share your own thoughts and experiences. Tomorrow, on day 2 of the summit, we're switching to a working session for local, Indigenous, African, Asian, and Latin American CSOs only. In this working session, CSOs will work in small groups and do a deep dive into the Health for All advocacy toolkit and begin developing advocacy strategies. We had an overwhelming response to the day 2 offering, and I want to thank everyone who shared the invite with your networks. We're really heartened by the turnout, and we're eager to continue working with this global network of community champions.